Hello, and thanks for joining us today. I would like to give you some important information about working with lesbian, gay, bisexual, transgender, questioning, and queer people who engage in harmful substance use. The plus in this acronym is there to acknowledge the many sexual orientations and gender identities that are not explicitly represented. As we go through this information, keep in mind that some LGBTQ+ people experience negative health outcomes because of the stigma and discrimination they experience, not because of how they identify. All people experience stress. This general stress can come from a variety of sources, such as being laid off from a job, the death of a family member, a physical illness, or a mental health condition. In addition to general stress, many LGBTQ+ people navigate a host of unique, complex, and harmful circumstances. These include anti-LGBTQ+ discrimination, such as discriminatory laws and policies, social prejudice, violence, and harassment. LGBTQ+ people often face the choice between concealing who they are or being rejected by their family or friends. All of this creates something called minority stress. Some LGBTQ+ people may use substances like tobacco, alcohol, opioids, stimulants, or other drugs to cope with minority stress. Data from the 2020 National Survey on Drug Use and Health show that sexual minority adults, those who identify as a sexual orientation other than straight, report higher rates of substance use than the general population of U.S. adults. For example, in 2020, about 41% of sexual minority people ages 18 and over had engaged in marijuana use in the past year, compared to only 19% of the general adult population. In that same year, about 7% of sexual minority adults had misused prescription opioids or used heroin versus only 4% of the general adult population. In pooled 2021 and 2022 NSDUH data, sexual minority adults had higher rates of substance use disorders than straight adults in the past year. For example, 16% of lesbian women and 17% of bisexual women had a past year alcohol use disorder compared to 9% of straight women. 19% of gay men and 16% of bisexual men had an alcohol use disorder versus 14% of straight men. Similarly, 3% of lesbian women and 6% of bisexual women had a past year opioid use disorder versus 2% of straight women. These data mirror what we find among populations of men, with bisexual men having the highest rate of opioid use disorder at 5%. Data from the 2015 U.S. Transgender Health Survey demonstrates similar patterns of disparities among transgender adults. More than 25% of participants had used marijuana, compared to 8% of the general population. 7% has misused prescription drugs, compared to 2% of the general population, and 29% reported any drug use in the past month, compared to 10% of the general population. Even with these disparities and stories in mind, it's important to remember that LGBTQ+ communities continue to be resilient. Social support, particularly LGBTQ+ identity affirming support within one's community and from family members, can promote resilience and healthy coping with minority stress. In fact, many studies have shown that when LGBTQ+ people are surrounded by love and support, they thrive and are better equipped to handle prejudice and discrimination in larger society. Here's how you can help as someone providing services to LGBTQ+ people. Make sure that your agency provides training to all staff on LGBTQ+ affirming care methods. Hire known trainers and experts in this area to ensure staff are properly trained. Also, be sure to create and implement non-discrimination policies for your LGBTQ+ staff members and clients. Place images and symbols like rainbow flags and trans pride stickers throughout your practice setting to indicate that it is a safe space for LGBTQ+ clients and ensure that you include affirming and supportive care throughout all programs and services. Use an electronic medical record system that documents the name and pronouns the client goes by, in addition to their legal name. When communicating with the person or discussing their care with other members of the treatment team, you should only use the name and pronouns they go by, even if that name is different from what is on their ID or insurance card. On clinical forms, include spaces for clients to write in the name they go by, their legal name, pronouns, sexual orientation, and gender identity. When you introduce yourself to a client, include your pronouns and then ask theirs. For example, my name is Mika and I go by she, her. How would you like to be addressed? Add pronouns to staff name tags, email signatures, business cards, and website directories. This normalizes the process of disclosing and respecting everyone's pronouns. Hire LGBTQ+ staff and ensure that all staff members, such as administrators, receptions, program staff, are all LGBTQ+ affirming during the recruitment, interview, and hiring processes. Intervene when you see overt and subtle forms of discrimination against LGBTQ+ clients or staff. Be sure to rely upon your agency's non-discrimination policy here. Avoid making assumptions about clients' identities and use gender-neutral language in titles and when addressing people. For example, don't assume a client is dating a woman just because the client is a man, or that their family is made up of a father and mother. Offer LGBTQ+ focused programs and support groups. Listen to the lived experiences of your LGBTQ+ clients. They have important stories to tell that may help you understand the best approach to prevention, treatment, and recovery from harmful substance use. Lastly, continue to build your knowledge about LGBTQ+ populations and the ways you can help and teach others what you have learned too. With every space that becomes more affirming of LGBTQ+ people, the risk of negative health outcomes and harmful substance use decrease. Remember that each staff member has an important role to play and can actually help save lives by using these strategies.